Okay, so I will start with an overview of what we think could be changed or should be changed on the current approach, so on the current strategy. And we did it with a couple of questions. And one of the questions was, do the existing standard assays which we use nowadays in the battery, are they sufficient for hazard ID, or do we need new or other tests added to this strategy? Well, after some discussion, it appeared that, okay, the standard assays are sufficient, the one we use now, but the nature of the compound is often not considered in the strategy, and also we may need tests which are covering also mode of actions, because these are, in our opinion, very important for regulatory aspects. And also the relevance of in vitro positive result is often not considered. We have a positive and whoop, we go to in vivo testing. And I think we may have some consideration if we have a positive result, what it does mean also for further testing. The current tests are also sufficient at the moment, as long as you want an answer to is it genotoxic or not? So for hazard ID, I think then it is sufficient. But if you want more, if you want to do some, for instance, some quantitative approach, then in our opinion, the standard battery has to be adjusted. And you can do that either by improving the current assays, but more efficient, I think it would be if we introduce new NAMs into this strategy. The second question was also very obvious. Many institutes use a two-test battery, some use a three-test battery. What is the best option? Are they both good, or if even another approach may be better? It was clear that the performance of the standard in vitro test has not been sufficiently evaluated. The two tests is based on a paper, I think, from David Kirkland from 2005, where he demonstrates that with the Ames test and the in vitro micronucleus test, you can cover the whole bunch of tests. But the results, even in that time, indicate that the more tests you have, the more false positives and false negatives you get. So in that option, the two-test battery was better than the three-test battery. And what you see is a bit more tests that the sensitivity, of course, increases, but the specificity dramatically goes down, even to about 20% if you have a three-test battery. From our conclusion, from our discussions, it was very clear that there was no consensus for a two- or three-test battery, but there was agreement that a more flexible approach, depending on the chemical that is assessed, may be desirable. And what I mean with flexible, I mean that before starting testing, you try to get as much as information you can get on the compound. A lot of this information is, of course, already present at the industry. So it would be very nice if we could get this information also, but try to get as much as information on the chemical, physical properties and that kind of thing. Then make a plan how you want to test, and then start testing. So don't start testing immediately from, whoop, you have to start. No, think about what you can do. And it doesn't always be need to start with the Ames test. If you have a plan, then you can start with everything you want. So this was, I will not say there was consensus, but there was a lot of agreement that this should be better, that we should make the test battery more flexible. Another point was that the conversion of the strategies between sectors would be very good. It is challenging, but it may be a very good option, because we know in Europe we have this initiative, one substance, one assessment. So maybe that will be the trigger for the regulatory institutes in Europe to come to with one strategy. The third point that we discussed is there still a role for the Ames test? I know this is very controversial, But for the IWGT meeting in Ottawa 2 years ago, and at the RIVM, we did the initiative to try to demonstrate, to find out which combination of tests is qua predictivity the best. And we did this by a Bayesian approach. We did this along 3 groups. So we had the Ames test results, we had the results of the chromosome aberration test coupled, so the results from the chromosome aberration test and the micronucleus test were one group, and the third group was the results from the HPRT and the mouse lymphoma assay also as one group. We did this comparison not against carcinogenicity endpoint, but we had as reference in vivo genotoxicity. So, and if we try to see the sensitivity of, for instance, the Ames test, we compared it with the in vivo mutagenicity data. If we did, we used the chromosome aberration tests, we use as a reference the in vivo results on clusterogenicity. And the results were astonishing for us, at least for me. First thing was that if you take every cell test, every test alone, then they were all good. All had a sensitivity of about what we expected, about 70%. And it was really concordant with the same endpoint in vivo. But when we used a battery of 3 test types, and we compared it with the total positive result, with the total result we had on in vivo tests, then we saw that the contribution of the Ames test to the results were almost negative. The result was almost completely determined by the results from the test from the mammalian cell, with mammalian cells. Also, if we have a 2-test combination with micronucleus, with the Ames test, the results were almost all determined by the mammalian cell test. We also compared the micronucleus test and the Ames test, and we did the mammalian cell test with each other, and then you can see that the results from both mammalian cell tests were better than the combination Ames with the micronucleus test. Of course, it was the first attempt that we did it. We had a very big database, 2,200 tests. The tests were not curated, so there may be some results which are not completely correct. But I think it was a very good database. It was from 10 parties we got data. Of course, we wanted to go on with this work on RVM. I am immediately retired. But we don't have money and we don't have time to do that, but it would be very good if we could go on with this kind of research, because we now demonstrated that the Ames test has not so much contribution, but we want to confirm this, of course, in perhaps an increased database, or with a database which has a learning set. So there may be some, we can optimize this kind of research. We discussed this, of course, also in our work group, and of course there was no consensus on the question, is there still a role for the Ames test? Neither was a consensus on, is the battery of mammalian cell tests much better? But I did a voting, of course, and it appeared that 6 of the participants wanted to skip the Ames test, and 8 of them wanted to keep, 6 wanted to keep the Ames test, and 8 wanted to skip the Ames test and were more in favor of the mammalian cell test combination. And I think 25 or so didn't want to vote. So this is what of the first part, and now Rafaela take over for the second part.
Okay, so then we went to newly developed in vitro test methods, and then we referred as when we were referring to them, we said NAMS, new approach methodologies, and what we just heard, the current standard in vitro battery gives a yes/no answer, and provides limited mechanistic information, so sometimes, very often, it's difficult really to be confident on a firm conclusion on that battery. We heard that there is already a variety of NAMs that is available and already in use. And also we waited, we asked a question at the beginning of the workshop, and we saw that actually already 2/3 of the participants, and we had quite many participants, around 50, had experience with at least one NAM. However, there was more limited experience by the regulatory authorities, even if EFSA has seen some NAM data and considered them within submitted dossier or within their evaluation, but they consider them as supportive information with less relevance in relation to the standard test. Often these data were from literature, and these are not requirements. So also, I mean, it was clear that the situation is very different across regulatory framework and also across the globe, and we heard about US situation, FDA. NAMs have also different status. Some are in the research development phase, others are already optimized, others are ongoing validation or peer review, so some are really closer to regulatory acceptance. So then we discussed, but what should be the role of NAMs? Should they be used to replace completely the current battery, to replace in vivo test, or to add information to the current strategy? And I think here we were happy because we had quite a consensus that they should be used to add information to the standard battery. So we should not get rid of the standard battery for the moment, but they could add information to identify mode of action rather than replacing it. And very importantly, to distinguish between direct and indirect mode of actions. An example of biomarker tests that provide additional mechanistic information were made to the group. This would allow them to take an informed decision on the follow-up evaluation, which is critical to refine hazard ID assessment, but also to inform on whether a quantitative follow-up analysis would be useful. And I mean, also, it was said that this type of discussions are already happening at regulatory level, but the problem is that the data are not sufficient and assessors do not have the means to ask for further data in the current regulatory framework. We also talk about higher tier tests, and these are those that are based on 3D models. The most advanced are the one in the skin, genotoxicity applied to skin 3D models. And if sufficiently validated, they may have potential to replace in vivo tests. Opportunities, to apply NAMs in areas like impurities, which are less regulated, so there is more flexibility. Develop NAMs with adequate metabolic capacity, but also learn from the cosmetic sector, where animal testing is forbidden, and their experience. And we have the SSCS committee, so this is the Scientific Committee for Consumer Safety, that already issued a note of guidance, and they already are doing the assessment without using animal data. Several NAMs have the potential to be used for quantitative assessment, so that was the statement, but there, of course, we would need more case study to learn more about that. There also are promising results from transcriptomics-based signature assays, with the possibility of integrating signature in whole genome analysis and obtain additional mechanistic information, also to be used as bridging data, maybe in a read-across. Then, some recommendations were made. First of all, I mean, how I think we have the opportunity here to transition from hazard idea, pure hazard idea, to hazard characterization approach. And NAMS can help to do that. So one recommendation was to add some checkpoints at different level of the assessment, for example, after the assessment of the standard battery, and define some criteria for the need of more data which would be useful to do hazard characterization before moving into in vivo. So that means that now, I mean, there is not this possibility to, from the regulatory authority to ask for more data, but this would be a mean to be able to ask for more in vitro data, and data maybe also from NAMS. Also, it was said that, recommended that a guidance on weight of evidence to consider more information to help registrants and assessors to take more informed decision would be useful. And we also talked about integrated approaches for testing and assessment, IATAs, and this is the terminology of the OECD, which would allow also to harmonize the way you do your weight of evidence. We also talked about in silico, and clearly the approaches have improved and matured due to the extensive use in the last 10 years in the context, for example, of the ICH M7 guidance for pharmaceuticals, impurities, and also read across within REACH. For QSR models, the quality of the models is strongly dependent on the data density and quality, and the AIMS reactivity-based models are very mature, but other apical endpoints need to be improved. Models for other apical endpoints need to be improved. The models that are based on in vivo data would be highly desirable, so, and concerted effort across the industry would fuel this. We do not have them at the moment, not good ones, and it was suggested that the model could be built on overall in vivo genotoxicity, which would increase the number of data. Further improvements are also expected through improved artificial intelligence technologies. And finally, well, the regulatory uptake is variable, and data are typically used for decision-making only for contaminants, impurity, and also metabolites assessment, mainly QSR, but it's also broader now for read across within REACH, also thanks to the framework, the read across frameworks that also was published by ECA and gives a lot of guidance. It's quite stringent on how to do read across. So with this, I hand over to Stefan to go deeper into the quantitative assessment.
Thank you. Thank you very much, Raffaella. So for the topic of quantitative assessment, of course, there is quite a bit of overlap with what we have heard already, maybe unsurprisingly, and also, of course, unsurprisingly, when you talk about using this more in a risk context from in vitro data, there is, of course, I mean, the level of acceptance is probably even a bit lower, right? And I mean, we had a lot of discussions here. What we kind of distilled out of that was that basing risk decisions on quantitative modeling on in vitro data sets is a step change, and we recognize that regulatory acceptance of this concept may need a paradigm change away from hazard. I mean, from a pure hazard ID focus, right? So a lot of progress was made in the last few years with in vitro to in vivo modeling from GeneTox data, and that was pioneered by the HESI GTTC, at least in a broader sense, with leadership from Health Canada. And with constant refinement, the models have been getting closer and closer to in vivo estimates, and we expect to continue seeing improvements there. So really, I think we have seen how the values converge more closer to what you would get if you really looked at the respective in vivo studies. So the work group agreed that while promising, there are still many open questions, and obviously not surprising since there's still quite a few even on the in vivo side. And further standardization should be targeted for both the biology and the modeling aspects of in vitro to in vivo extrapolation. For modeling, we do expect that it will profit from advancements in the PBPK modeling area, which is really a broader activity. So we will get some synergies from there. So that should really be helpful in that context. So while in vivo modeling can be done from any GeneTox data set in principle that has enough data points, and of course a positive response, we suggest that the choice of the best cell type and genotoxicity endpoint should be informed by existing knowledge about the respective substance, for example, its metabolic fate, the mode of action, and so on. So standard in vitro test, with the possible exception of the Ames, I mean, for fairly obvious reason, bacteria versus mammalian type cells or human cells, as well as NAMs actually could be used in that space. So we also had a lot of discussion about cell types, and I mean, similar on the in vivo side, you know, the question, do you need to look at more organs? Here, that's also one of the questions, right? I mean, how many cell types would you need to use? And I mean, should it be human cells? Should it be exclusively human cells or not? So we had some discussion about that. And I think probably people would want to see more than one cell type in that context. The ideal data set would have more dose levels with tight spacing, but I think similar to that discussion in the morning, I mean, really at the end, of course, the question how tight your data are and whether your point of departure, you have a factor of 2 in there, may not be so important depending on how many uncertainty factors you put on top, right? That may not be the key question. So the uncertainty factor certainly also for in vitro is a very important question. It was agreed that the use of potency as a guiding principle for substance evaluation could be a low-hanging fruit for chemicals within a substance class, for example, pyrrolizidine alkaloids, an area that was mentioned already this morning, plant-based impurities or PAHs, for example. And I mean, generally, of course, these are classes where it's less controversial, unavoidable impurities, so we think that could be used, and potency, of course, is easier to start with comparison with a complete in vitro to in vivo extrapolation. So rank ordering and comparing potencies in a class, I think could be, and then build from there. That would be a good thing to do. So quantitative AOPs were also discussed as an alternative concept, but I think there was agreement in the work group that these are at the proof of concept stage, and it is a bit premature to assess their utility at this point in time. So, I mean, those were the key points in there. I'm, of course, happy to hear some additions, if there's any, for all the 3 presentations from the work group members or any key points we missed. And again, big thank you to all. We had very active contributions, so a lot of good discussions. So, thank you.